Hi, everyone. Can you see my slide in full screen?
Yes, we can see.
All right.
Go ahead.
So my name is Semira Abdelmenan. I am a researcher and a PhD student at Addis Continental Institute of Public Health. I work in the EAT Addis study. The EAT Addis study is a collaboration project among Addis Continental Institute of Public Health from Addis Ababa, Ethiopia, and Uppsala University, Lund University, and Swedish University of Agriculture Sciences in Sweden. So this is one of the study findings from the bigger project. The project was funded by Swedish Research Council FORMAS. So I will be presenting on behalf of the team, the social stratification of availability, affordability, and consumption of food in families with preschoolers in Addis Ababa. So as you all know, malnutrition is one of the most serious public health challenges globally and in Ethiopia too. So the driving forces are multiple, including changing dietary and physical activity patterns, moving from traditional food system, which was mostly dependent in farming, to dependency upon income generation in the market. These transitions are more prominent in urban settings. Therefore, the aim of this study was to understand the quality of diet being consumed among families in urban setup in Ethiopia. So Addis Ababa is the capital city and the biggest city in Ethiopia. The second aim was to what extent social stratification and perception of availability and affordability of food affect healthy food consumption. So when we come to the method we used, it was a community-based cross-sectional study conducted in 2 rounds in the city of Addis. We used a multi-stage sampling procedure. The city of Addis at the time of data collection was divided into 10 sub-cities, and then the further divided into 160 districts. So we have collected data from each district, and all households at least with 1 under 5 children were eligible to participate in our study. When we come to the food and diet tools we used, we have used a 24-hour recall method. We used it in 2 steps. In the first step, we have used food listing approach, like listing food and beverage consumed during the previous 24 hours. And in the second step, we have used food groups pictures. It's shown in this slide. We use the picture to probe for foods possibly forgotten during the first step. Then during the analysis for this study, we used a modified version of the Women's Minimum Dietary Diversity Indicator. It measured quality of diet, both in terms of energy and micronutrient adequacy. This modified measure used in this study, we call it family food group rather than the women's minimum dietary diversity. It has 11 food groups rather than the 10 as it's usually measured. Based on the local consumption pattern, we grouped fish and meat, the food group food and meat, and vitamin-rich fruit and vegetable were further split to individual groups, and we merged the legumes with nuts and seeds because nuts and seeds are not commonly consumed in the study setting. So in the study, we have 11 food groups and we call them family food group. Another important concept in the study was the measurement of food availability and affordability. We have measured both availability and affordability based on perception. So the perception of food availability was assessed by asking the consumption of food items in the day prior to the survey, or availability of the items in the local market if it was not consumed the day before the survey. The second concept of the perception of food affordability, we also assess that by asking the participant how often the household can afford to consume each of the food items. So when we come to the study results, we have in total, we have visited more than 14,000 households. Based on our eligibility criteria, more than 5,000 of households were eligible. Those who do not have under 5 children were not eligible for our study. And in some setups, the mother or respondent were not available. Then among the eligible participants, we asked their consent. We excluded around 64 participants because they didn't offer their consent. So with 98% of the total response rate, we managed to get 5,467 respondents. So our results consist of these all respondents. When we come to the first findings, the socio-demographic characteristic, more than half of the mothers, which is around 61%, were in age group between 25 to 34, and 88% were married, and more than 47% of the participants had secondary or higher level of schooling. 1/4 of the mothers involved in any income generation activity, and 3/4 of the households were male-headed. The average family size for the households in our study was 4.3, and only about 1/5 of the family have owned their own household. Its owning household showed that the level of wealth in the city of Addis. And access to improved water was highest, it was 98%. And when we see toilet facility, 76% of them used a shared toilet facility. When we come to the first aim, which is to see the availability, affordability, and consumption of food, as you can see in the graph, the green shows perceived availability. Most food groups were perceived to be highly available in the market. As you can see, most of the greens are taller, so which shows that most of the food groups are perceived to be available in the city by more than 90% of the participants, except fish. If you saw fish over here, it is around 73%. Except the fish, all the rest of food groups are more than 90%. People perceive that their availability is more than 90%. When we come to the affordability, considerable variation were observed in the perceived affordability of family food, ranging from 15.5% to 90%. Fish was perceived less affordable by 50% of the household, and other food groups perceived to be affordable by less than 50% of the household, especially including the vitamin A-rich fruit, other fruits, and meat category. The highly perceived affordable groups are included, like as you can see over here, cereals and other vegetables and legumes are perceived to be available. Except those three food groups, the rest are very low, below 50%. When we come to the consumption, the main food consumed in the study population were cereals and white fruits and tuber, followed by other vegetables and legumes. The reported consumption of fish was very low. The consumption of other food group was also reported by 50% or less proportion of the household, like vitamin A-rich fruits, green leafy vegetables, vitamin A-rich vegetables and fruits, other fruits, meats, and eggs and dairies were perceived to be less consumed by less proportion of the household. So the consumption pattern shows that households have a monotonous staple diet with limited diversity, and the three most highly consumed food groups are cereals, other vegetables, and legumes. When we come to what extent social stratification affect consumption of healthy food, to evaluate the relative contribution of wealth, maternal education, and perceived affordability, which we consider as a social stratification to family consumption of different food groups, we examined their association using different models, and after controlling for other known factors, households in the top wealth categories, that is the fourth and highest quantile, had higher odds of consuming micronutrient-rich foods compared to households in the lowest quantile. Also, the same is true for education, where college-educated mothers had higher odds of consuming micronutrient-rich foods as compared to households with the least educated mothers, those never attended school or finished the first grade. We did the same for affordability after controlling for wealth, maternal education, food security status, and clustering effect in our model. Those who reported higher affordability were more likely to consume the food items, except for vitamin A-rich fruits, the odds of consuming micronutrient-rich foods and other protein-rich animal source food were significantly higher in households that perceived they could afford as much as they want than compared to those who couldn't afford the food. When we come to the conclusion, although all the food groups necessary for leading a healthy and nutritious diet were perceived to be available in the food environment, there was a large variation in the perceived affordability and in the actual consumption among the households of Addis Ababa. So generally, households' food consumption lacked diversity, especially the consumption of micronutrient-rich and animal source protein-rich foods, which were highly limited. All three socioeconomic aspects, those are the perception of affordability, maternal education, and household wealth, were independently associated and to a similar extent contribute to a variation in consumption. So food policy in this rapidly urbanizing city need to be considered these factors in order to improve the nutritious status of children and families, with caution of interpretation that this recommendation may be useful to other low-income countries, major cities as well. I will conclude my presentation here. Thank you so much.